We met Dr. Bowen about 3 years ago. He's in Independence, Missouri. A very forward-thinking dentist, so matched up with us perfectly. And has done a lot of the clinical field testing of our product. He's worked with Oral DNA Labs, done a lot of work in his own office. His partner, Dr. Kurt Opdahl, has been using the products as well. So there's 2 dentists that have done a lot of testing of the product. We are in 3 countries. We are in the United States, Australia, and Canada with our products. So Dr. Bowen is a practicing dentist, like I said. He's a graduate of University of Missouri, Kansas City School of Dentistry, which is where we're from, Kansas City. He's a general member of the AACD, and he's on the board of directors of the Greater Kansas City Dental Society. So this time I'd like to introduce Dr. Bowen, and I appreciate you coming today.
Thank you. Well, I'll tell you what, first hearing about the rinse, and then we started using it about 3 years ago in our office. I started seeing some neat things happen because we used some testing through Oral DNA Labs. And the people that had bacteria in their mouths, when we were testing it after they used it a couple weeks, I was like, wow, this stuff is actually removing bacteria. Because at first I'm a little skeptical. I'm like, the ingredients that are natural, coming through dental school, I'm always taught chlorhexidine. That's our gold standard, but it has a lot of bad in it. It has stain. People don't like stained teeth. They don't like the bad taste. And so having something that tastes a lot better, and it actually helped the teeth stay white. In our practice, we do a lot of advanced reconstruction, cosmetic surgery. So people don't want to come through and then all of a sudden, I got to treat your disease, but by the way, your teeth are going to have to be brown and stained. So I was really excited when I started seeing results with the rinse, and I said, why don't we try to take this one step further? Why don't we try to start using this in the mouth with a more concentrated form? And that's when we got the serum that is something that I use in my office, and it's really helped a lot because when you tell somebody you need a deep cleaning, or you need scaling and root planing, their automatic reaction is, I don't want to do that. I've heard the horror stories, I've heard, it's going to be painful, and nobody wants to come to your office and have pain. So we started developing this, and what I found is that the patients were coming back for their checks maybe 5 days, 10 days, a couple weeks later, and they said, Doc, I don't know what you did, but that gel that you used or how you did my deep cleaning, my teeth haven't been sensitive, and I've noticed a big change in, how my breath is. I've noticed a big change. Now my gums don't bleed every time that I'm flossing or I'm brushing. So I kind of knew that, whatever was in this gel was starting to make a big difference. Because at our office, we try to always build on a healthy foundation with the proper gums before we'll do any type of, cosmetic dentistry. So the technique that I've practiced, and we've used this for about 2 years, is that, the patient will come in, we'll evaluate everything, we'll say, okay, you need a deep cleaning. We'll have them start in on the rinse. And it's great because this rinse, when everybody's seen the what's the video that shows everything splattered?
Saliva were red.
Yeah, if saliva were red, the spray of everything. So now the patient can rinse with this before we ever get started, and we're already reducing the bacterial load. And so what I noticed is we use an ultrasonic scale or a Titan, a piezo, whatever it is, and we'd go down into the pocket and we would clean out. And in school we're taught mechanical debridement is the best. But we're always kind of reluctant to use any type of antimicrobial, whether it be, local or systemic. Because one, it's the cost is involved, and then what are the side effects are going to be, because a lot of people don't want drugs introduced into their body. Whereas this, it's something that's natural in the ingredients, and we're able to put that down into the socket. And what my technique is that we've done is we'll go in and we'll go around with the ultrasonic and hand instruments and go in and do scaling and root planing. And then you really feel like you've done a great job. And what I do is I'll take this gel and just irrigate the sulcus out. You know, I'm not going deep, but it's integrating what we found through testing in Indiana. It actually integrates with the saliva and that crevecular fluid. It's actually, you know, a lot of times that's always been our enemy with different types of antimicrobials, that was hindering us. Well, this has been tested, and it's actually kind of integrating with that to kind of get down in there. And this has a foaming action due to the peroxide that's put in it, the carbamide, and all of a sudden I saw a lot of bad stuff floating back up because it's foaming. It's kind of effervescing that pocket. And I thought, wow, I thought I was really good at what I did, or our hygienist thought, wow, they were really good at the skilling and root planing, but now we've got all this crud basically coming back up out of the socket. And so we would go back through with our ultrasonic, and that stuff would come out more, and we'd go back in with this syringe, and you'd see a little bit more bubble out. And after about 2 or 3 times of doing that, you're able to see, you know what, now we've just about basically got this clean. We've got this site clean. And to me, what sells it is the fact that the patients are coming back with their gums looking good, and they didn't have that time, that healing time where things were really sore from all the aggressive, you know, work that we had done. So I got to thinking, you know, if this is doing good stuff here, we do a lot of wisdom tooth removal, a lot of third molars, especially in the summertime. And so in the socket, you know, a lot of oral surgeons will use a mixture of saline and hydrogen peroxide, you know, irrigate that out. So, you know, a lot of times people come in, they wait too long, they've got a little pericornitis that is associated with that wisdom tooth coming in a little bit tipped. You know, we always treat them with antibiotics ahead of time. And I was telling Janice, typically every summer I have about 3 or 4 cases, you know, out of a ton of wisdom teeth that we take out that you'll get a dry socket. But, you know, we've been irrigating with the rinse, and then I still follow up with some saline, so this isn't just going to stay down there, but it allows the blood clot to form. I was telling her we really haven't had any dry sockets this summer, so it's been great to see the people's healing. You know, to me it's all about, you know, one, we're not doing any harm, and people, no one likes coming to see the dentist, so anytime that we're able to make their experience a lot better, and they come back and tell me, hey, you know what, that wasn't as bad as I thought it was going to be, we're doing some good. I have a couple pictures that we'll bring up. Okay, here was a guy that came to me, referred by one of his co-workers, a male that was probably in his middle 50s. In this pocket depth, this picture is kind of white, but we could get our probe basically down to here on the distal of that second molar. And he had already been to another dentist, and the dentist said, let's take that tooth out. And this is a guy that's never had a tooth taken out. He's about 6'6", 300-pound guy, but when it comes to the dental chair, he's really scared. You know, and he goes, Doc, I don't know what you can do, but I would highly like to try to save this tooth. And I said, look, you know, this is a tooth that, you know, it's got mobility. You can't bite on it, but you know, I'll put you on a round of penicillin, and we'll go in and we'll clean it out, and I'll use this new antibiotic that I have that's in a gel form. So I explained everything to him. He goes, I know it might not work, but go ahead and try it, Doc, because I really don't want to lose this tooth. So we went down 2 different times. We waited about 2 weeks in between, but just cleaned that out, and I was just shocked by, you know, it's hard to get any type of instrumentation down that low because I didn't flap it or anything. But just irrigated it and put the dental gel in there. I took the tooth out of occlusion so he wouldn't be biting hard on anything. And it is kind of hard here. Let's see here. There's one. So that's what it looked like a month later. A month post-op, we were no longer able to get our, we hadn't really gained reattachment all the way, but I was unable to get my perio probe down. You know, it was going down basically all the way at first. So this time we were only going down about 7 to 9 millimeters, and that was a month out. And I worked on this guy 2 years ago, and he comes in every 3 months for perio maintenance. And we take a look and see how that tooth's doing. And 2 years later, he still has his tooth. You know, so is it still, you know, the best possible situation? No, it's not. But he's able to maintain it, keep it clean, and he uses the products at home. So a guy like that has referred in several patients to my practice because we were willing to listen to the patient and kind of do what they say as long as we had things that we could do to kind of help make that work. Another patient that I had, let's see here. Okay. Here's a guy that came in with, he had mandibular tori that were almost above his occlusal plane. And they were getting so big that the frenal attachment was getting caught of his tongue. So we had to take out the tori, remove them, and this was taken 2-day post-op, okay? Or 1 week actually, 1 week later. And I actually made him a little stent to wear where he was taking the gel and just keeping it under that little, basically like a whitening tray because it was just so sore. Perio pack wouldn't have worked there. He was still, you know, his pain here was probably about a 4 from what he told me. And then this is what it looks like at 4 weeks, okay? So you can see, you know, this, with all the lighting and everything, the color of his gums down there where we did that, the gingiva, was a lot pretty consistent with everywhere else in his mouth. And the thing that I like the best about the gel and the rinse is that it also provides the patient good pain relief. What's in it, you know, to kind of help it work, it's just amazing because they can put that on their wound or on their sore and they're able to, man, that sure makes that feel a lot better. And it's not quite like we're putting lidocaine ointment on it or anything, but it just kind of takes the sore out. And so, you know, I've had a patient where we did an immediate denture, took out all of their top teeth, and she was really heavily perio involved, had to do some alveoplasty, and got her new denture, and she came back in for her 24-hour check, and she's like, you know what, all my friends were telling me how bad this is, but I'm not even hardly sore today. You know, I can tell I had something done, but she was keeping the gel up under that denture, just kind of allowing that to soak in, and she came back, you know, to get her stitches out in 7 to 10 days, and it looked like everything was really nicely healed up. I might have another picture here. Let's see here. Okay, here's a patient that we did an extraction with a bone graft in the upper right quadrant. And this was taken, this picture here was taken about, I think it might have been actually the day we took the tooth out. So this is my before picture. And then this picture here taken 7 days later when we took the stitches out. And so the gingiva, actually on this patient we didn't do a bone graft because I didn't do a tissue graft. But what we did was I actually took some gel foam, and we have also some dental gel. This is the debriding, and there's another form of the gel that does not have the carbon peroxide in it, and so that's not going to have the effervescent effect. But what I did was I took some gel foam, soaked it in the gel, packed the gel foam in, put the sutures in, you know, and that patient felt really good a week later. And they said, you know, they just had a little bit of soreness, but I was just amazed by how quickly it returned to pink gingiva. So, you know, using it in our practice, we were able to just see, you know, how many different applications can we use it on. my other partner, Dr. Updahl, places a lot of implants. He likes using it because it just helps the implant. You know, he'll put a healing cap on when he places it, and then getting the gingiva just to adapt and be, I've got some other pictures that aren't on this thumb drive, but just amazing how quickly we're seeing turnaround of healing times. So, you know, to me, one of the major selling points are my patients like it. The taste of it, you guys will get to try the taste of it. It's very pleasant compared to chlorhexidine. You know, it's not something that you're going to go out and drink every night, but it's doing its job. You know, and some of the people are like, what is in this? Is this, you know, I've heard reviews from my patients. They're really honest. But overall, it's been really, really positive. The other thing that I like, you know, is it's restoring the pH in someone's mouth. And we've had a couple of our close friends that have had cancer. And, you know, it hits close to home when it's somebody that you know and they're struggling. And they go through chemo. And a lot of times chemo has to be stopped because they can no longer swallow. They can no longer function. It's the pain from that. And by just using the rinse, they were able to keep on their chemotherapy, and the pain of their tongue, you know, one guy's tongue that we knew turned black from his chemo because he had a stomach cancer. And it's just amazing the night and day difference that we've seen with people that have been using the rinse. So, you know, when you see stories like that of people that you really know, it's like, you know, this could really make a big difference if people knew about it. Can you think of any other things that we've done with it, Janice? As far as different times that we've used it?
The lady with the cancerous tumor that you removed?
Oh, yeah. We had a lady that she had a little lesion that popped up on her lip, you know, and it was just, you know, right on the vermilion border. And we took that off, you know, and she was a lady that was concerned with her appearance and all. And, you know, taking that off, she was able to put this gel on, you know, and just keep that on there every day. And, you know, her pain was low. Her, you know, and then we found out that it was cancer, and I sent her over to a cancer doctor to make sure everything was gone. But this was just a little biopsy that I had done. But just allowing her healing time to go through made it so much better for her. So there's been a lot of different applications that we've used it on.
Dr. Bowen, the young man who's in the train crash.
Oh, yeah. I had a guy that was referred to me from a medical doctor, and he had a bad accident where he did not see, there was a train going this way, but he did not see the train going the other way. So when the first train ended, he thought it was clear. Well, he was lucky enough to survive, but basically had lost a big portion of his mandible, and part of his face got sunken in when the metal hit. And so, you know, the oral surgeons had done a great job of just putting him back together, but he wasn't really able to. It was just so sore in there because he had about 50 stitches inside of his mouth. And so by the time he saw me, he didn't want to open because it had been so much pain from the other people he'd seen. And a good friend of mine that works at the hospital sent him over to our office because he goes, well, these guys, you know, they'll take care of you. So we had him come in, and I said, are you able to get in there and brush or do anything? Because I could just tell the bacteria in there was horrible based on the smell. And so he said no. And so, I mean, I took a pano, and I didn't know that he hadn't seen what his injury really looked like. And so when I was just trying to explain to him on the pano what was going on, the type of stitches they put in need to be removed. They're not going to dissolve out on their own, but I know you can't open right now very far because it hurts so bad. So just having him on this rinse, he used it like religiously 3, 4, 5 times a day for about 10 days, and he came back in, and I was like, there's something different about you. I said, you're kind of smiling today. I said, what's the difference? And he goes, I can actually eat and drink now, and it's not hurting as bad. I can actually swallow things, because he was rinsing with that, And we were able to get in there and get those stitches out, which helped out a ton to be able to, just allow that bacteria to not be wicking on those anymore. So, that was another great example of somebody that really benefited from it.